All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. And my apologies, my mic was a little bit away. So, the discussion today is a very interesting study. It is from Drbeen University, Medical University, China. The study is a prospective, it's a meta analysis of other prospective studies from the psychology departments of various countries and universities that have looked at the effect of loneliness and social isolation on deaths. And the short summary is that people with social isolation who felt it and loneliness, which is a feeling, had a higher, statistically significantly higher risk of all cause mortality, cancer related, especially breast cancer related mortality, and cardiovascular disease related mortalities. This is a summary of it. It's pretty scary to see how much difference or impact this association of loneliness and social isolation makes to the uh, to the risk of death. So that is a study. I'm going to show you today the abstract of it and a general understanding of the study. There is a lot more in the analysis for how the analysis was done, what were the studies that were participant, and so on. I'm going to leave that part out and just discuss the impact. So let's look at the data together. So these are gifts from humanity. They're continuing. This is drbeen.com. If you would like to have access to beautiful lectures about asthma and allergies and cardiovascular issues and heart attacks and microbiology, and want to see some 3D anatomy and want to understand nervous system and the neurons and how the nervous system works, and dermatology and acute abdomen surgery, pharmacology, pediatrics, ophthalmology, then this is your place. And there is a beautiful link in the description that you can take advantage of. So with this, that is the plug for Dr. Bean. This is a study, a systemic review and meta-analysis of 90 cohort studies of social isolation, loneliness, and mortality. This is a link to the study, and you cannot get this PDF because it is for sale only. And I found out that on this research gate, you can download it for free. So maybe download it fast enough before they realize a problem or mistake and they take it away. So if you go to the link, this link is also in the description. You can download this study. You can say download somewhere over here. Somewhere over here is a download, and you can download this copy, and that gives you the PDF. So with this, let's look at the PDF together for a second and then my drawings. This is a PDF. And this is the abstract that I'm going to look at and some of the data. So let's go to now my drawings. So the loneliness is a subjective feeling of distress arising when there is a discrepancy between desired and actual social relationship or relationships. Meaning, if I thought that I have 1,000 friends and I only have 2 friends who are following up with me or staying in contact with me, then there is a discrepancy in what the desire or the understanding is versus what the reality is. So that is the subjective feeling of distress arises when there is a discrepancy between desired and actual social relationships. So this has to have a fundamental desire first, that hey, I want 2,000 people who are my friends. And then in reality, I have two. So that gap between the two then causes stress, and that is the feeling is then called loneliness. On the other hand, social isolation is a state that refers to an objective lack or limited, so this is objective, lack or limited social contact with other people, and is characterized by a person having a limited social network, having infrequent social contacts, or possibly living alone. So, this one is an objective state where the person does not have a greater number of contacts or does not have a higher frequency of contacts and so on. So, they are different. One is subjective, the other one is objective. However, their behaviors, their outcomes are very similar. So, here, what these researchers did, they took 90 prospective studies. So, these are not retrospective studies. They took 90 prospective studies. These studies collectively had 2.2 million people in them, some with social isolation and others with loneliness. And they looked at the all cause mortality in these individuals. They looked at cardiovascular disease related mortality in these individuals. They looked at breast cancer or cancer related mortality, and then just the breast cancer and the related mortality to that in the individuals with loneliness or social isolation. So here is the data. Social isolation and loneliness. The risk of all cause mortality increases statistically significantly, and in the social isolation, the risk increases to 1.32, so 32% extra. And the 95% confidence interval is 1.26 to 1.39. That is the range. And p value is significant. Loneliness, 1.14, so 14%. And the range is 0.08 to 2.0 or 1.20. So 8% to 20%. This is the all cause mortality increased in association with social isolation or or the loneliness. And the data is statistically significant. Then cancer. So mortality related to cancers increases the risk of all cause mortality, and actually cancer related mortality I should write here. And the data is in socially isolated 1.24, so 24% increased. Socially isolated plus cancer, and now leading to death, associated with now deaths, 24% increased, and the range is 19 to 28%. Loneliness with social isolation, 1.09, 9% increased, 95% confidence interval 1 to 17%, and p value is significant as well. Cardiovascular disease related mortality in the patients who also have, or persons, individuals who also have social isolation or the loneliness. So overall, 1.34, so 34% increase likely increased risk associated, risk of mortality associated with loneliness and social isolation, range 25% to 44%. So 1.25 to 1.44, p value is significant. Now, all cause mortality is increased in socially isolated individuals who also have cardiovascular disease. So that cohort that has cardiovascular disease already has it and then has social isolation or loneliness. They have increased all cause mortality. So the increase is 1.28 or 28%, and the confidence interval or the range is 1.10 to 1.48, 10% to 48%. Or individuals with breast cancer and cardiovascular disease and isolation or loneliness, 1.51. My apologies, my mouse. Okay, so I have to quickly stop sharing and reshare. My tablet's connection has broken. So it does this sometimes. So my apologies. I'm going to go back and see if it works. Nope, it is not working. So give me 1 second. I'm going to close this program and then restart it. Okay, got it back. Okay, with apologies. So back there. So patients of cardiovascular disease plus breast cancer plus also experiencing social isolation or loneliness, 1.51, 51% increase. And the look at the range, 34, 1.34 to 1.70. So 34% to 70% increase. P value 0.001. Now, individuals with breast cancers had a higher cancer specific mortality. Individuals already had the cancer. However, those individuals who had breast cancer and had the association of loneliness or social isolation had cancer specific mortality increased 1.33, so 33%. Confidence interval 0.2 to 0.75. P value 0.03. This is scary. And just, I'm saying just as if it is a simple thing, it's not simple. Somebody who's isolated or somebody who's lonely, it is difficult for them to reestablish those connections. So here we are talking about patients with breast cancer who experienced isolation or loneliness had a higher cancer specific mortality, not something else, cancer specific mortality. So their cancers, now this is my interpretation, which I could be wrong. So their cancers grew faster. Their cancers became more impactful to them, more negative to them. Now, so all of those things that I was doing, these ended up here. So my apologies for these weird marks here. So several possible pathways have been proposed to explain the adverse effects of social isolation and loneliness on health and mortality. Social isolation may promote unhealthy behaviors such as malnutrition and physical inactivity, which may increase the risk of death. Social isolation has also been associated with health related biological processes such as higher C reactive protein and lipid levels and poorer immune function. We know that whenever there is stress, then there are stress hormones, which in turn can switch off many of other healthy functions of the body. In terms of loneliness, mechanisms including deleterious health behavior, sleep disorder, and neuroendocrine and immune dysfunctions. So there is a physiological outcome as well, or pathological outcome as well, have been identified as contributing to the negative association of loneliness and health. So, one more thing that they said this has been a controversial topic for a long time. That is there a relationship of social isolation and loneliness with health and mortality? And they said we are able to actually look at 2.2 million people and 90 studies and then assess the data, and here is statistical significant proof. So, that is the discussion for today. Of course, a takeaway: a person who is in social isolation or in state of loneliness, they themselves cannot finish this. It is our job to take care of those who may have been in that state. And while I was looking at the study, I was thinking that during this pandemic time, I was so lucky that every day I was able to speak with a number of cool beans, a number of audiences, and I had that feeling of connection. We used to have chit chats every day for a couple of hours. And now, when I see in the context of this video, this study, I can imagine how much beneficial that was for me. I hope that was for the audience as well. But um, this is important to have the relationships and to nurture them, to cultivate them, and keep them going. So that is my takeaway. But, anyways, I wanted to make sure that we can look at this topic. Once again, thank you very much. I would request you to look at this whole paper as well, and I would see you tomorrow. Please like, subscribe, and share. And there are links in this description of this video. If you would like to support this, you can buy me a coffee, or you can use PayPal, or you can become part of Substack or Patreon, or you can even become part of Dr. Bean. The link is in the description. So, with this, thank you very much. Stay safe, happy, healthy, and connected. And I'll see you tomorrow.